Greetings, it's Bakker, naturopath, author of Candida Crusher. Thanks for checking out my video today. I'm going to do a comprehensive video today about vaginal thrush, about a female complaint that I tend to see lots in the clinic. We're going to talk about the causes and the treatment, what you can do, how you can get relief of this awful complaint in a short period of time to give you a better quality of life. So, I started treating Candida patients well over 20 years ago. And probably about the last 10-15 years, I've seen increasing amounts of women with this complaint, which has really affected the quality of their life significantly, to the point where I really wanted to write about it. And it was an important reason why I wrote my book, Candida Crusher. And if you look at the 5th chapter in my book, it contains a significant amount of information about this complaint, and the different ways you can tackle this complaint, get relief from the symptoms, and really put an end to it once and for all. I've treated lots of women with this complaint from, I'd say, easily 50 different countries around the world, predominantly from northern USA, but also from countries like Greece, Spain, Italy, the UK, Iceland, South Africa, Holland, many different countries. So some women I talk to feel ashamed to have this condition. They feel embarrassed. They feel it's because they're unclean, or they've got poor hygiene. But I can tell you now, this condition can affect you regardless of your race, your belief, your income level. It's got nothing to do with that. So about 20 to 25% of women normally have Candida albicans in the vaginal area. Not every woman has it, but many women do have it. And normally it sits there in a balance, and it's kept in check by the pH of around 4.2 to 4.5. There are corny bacteria and other beneficials, that are sitting in there that keep it in check. But for some reasons it will go out of control, and it can become, a really big problem. It can cause a lot of different problems: itching, burning, pain on intercourse. It can ruin a person's sex life. It can cause a hell of a lot of problems. So if you look at the discharge, a vaginal discharge is normally a thin whitish discharge which sort of peaks around ovulation. And in the luteal phase, which is just after the menstrual cycle, it tends to be a lot thinner and scantier. So that the common time for vaginal thrush to become very, very pronounced is usually just around that ovulation time, of course, when the discharge is at its thickest. Estrogen levels also start peaking, and estrogen is the hormone that makes the cells plumper and fatter, and glycogen, or a type of sugar, is secreted in the vaginal area, which allows Candida to bloom, just take off out of control. So this is one of the key reasons why women tend to get it much worse thrush before their period. So let's now look at the 10 main causes of vaginal and vulval yeast infection. This comes out of my book. So the first cause is a diet high in refined carbohydrates and sugars. So this could also be things like soda drinks, candy, alcohol, especially wine. Wine is a big one for women, I find. White wine, in particular, is a no-no. White bread, cookies, any of these foods high in sugars are going to make you more prone to having a gastrointestinal yeast infection, but also a vaginal yeast infection. Now, those two areas are very close together, and many women who tend to have intestinal yeast overgrowth will also get it vaginally for that reason, so you're more prone to it. So, needless to say, if we're going to clear up chronic vaginal thrush, we're also going to try seriously to clear up chronic digestive yeast infection as well. Because I believe that not just the vaginal area needs treatment, but the whole entire person needs treatment. Pregnancy and childbirth. So this is a key time many women also experience this. So this is a time of hormonal turmoil, and many women will have varying hormonal levels that can really push a yeast infection up to the foreground. Menstrual dysfunction. So irregular menstrual cycles, particularly in the week leading up to the period. So as I mentioned, if you're estrogen dominant person, you can be more prone to having serious flare-ups. So some women have way too much estrogen in their body. There are 3 types of estrogen, and E2 is the common one. When it's in very high amounts, can cause much more, is associated with a quicker proliferation of Candida. Diabetes. So women who are diabetic tend to secrete more glucose, of course, through their urine, and are more prone to having intestinal yeast infection and also thrush. So having your diabetes carefully controlled and managed can be an important part of keeping the thrush under control. Stress. Well, I've written extensively and spoken extensively on stress on YouTube and on my yeastinfection.org site. Stress has got an incredible way of reducing the person's immune ability by decreasing their cortisol levels. In the alarm phases of stress, when your stress is too high, and this can happen, for example, when you've got young children, or you're a single mom at home, or you're struggling with finances. If you're living under a lot of stress, it can mean your cortisol levels are way too high. This can cause anxiety, disturb sleep, but high cortisol also is implicated with pushing your immune system right down. And of course, when your immune system is right down, Candida can come right up. It gives it an opportunistic ability to proliferate. So you need to get a grip on your stress and understand, if this really is causing recurring thrush in particular. Pharmaceutical drugs. I've spoken about this extensively as well. The oral contraceptive pill, a hormone replacement therapy, antibiotics. These drugs are all implicated in thrush. And you know that. You may have been on an antibiotic in the past and had thrush. So think twice about antibiotics again if you've had bad experiences with this in the past. Nutritional deficiencies. So having deficiencies of many different kinds of vitamins and minerals, magnesium and B vitamins in particular, can predispose you towards recurring vaginal thrush. Chemical contamination. So the vaginal tissue is very sensitive. You may have heard of toxic shock syndrome. So some women have had problems with tampon usage in the past. Using personal care products. You need to be careful what you're using on the personal areas there. Sexual intercourse, especially excessive sexual intercourse. I've seen a lot of recurring vaginal problems in women, for example, whose guys work away for extended periods of time, then come back home. This can cause a lot of problems. So too much sex in a short period of time, particularly in women in their 40s and 50s who tend to have a thinner vaginal lining or lower hormone levels than women who do, in their 20s and 30s. So this is something to take into account. And of course, clothing is the last one, like nylon underclothing. Wearing clothing that's too tight fitting, it's not airing out the area properly. This can cause a real issue. So as you can see, there's 10 sort of causes, but I'm sure there'll be many more if you think about them. So what are some of the solutions? How can we actually get rid of this condition? That's what you're watching this video for, no doubt. So, and thinking to yourself, well, come on, Eric, just tell me how to get on top of this problem. Patience, all right? I'll tell you this in due course. Again, I'm going to reiterate, you need to think carefully. Doctor may not talk to you much about this, but I will. Don't just think about treating the vaginal area with creams or douches or things that you can apply. Think carefully about the holistic solution. Think carefully about the diet and the lifestyle, along with what I'm going to tell you now, because it's the total package that's going to help you get rid of this condition permanently once and for all. Many of the women I've treated we've successfully cured this condition have had this condition for 5, 10, even 20 years, and they got rid of it within 6 months. Some took 12 months, but on average 4 to 6 months with a really chronic case. And I got them to treat this thing really with their period successively. So anywhere between 3 to 6 menstrual cycles in a row, they treated this while they worked really hard out with the diet and lifestyle. And that's when the success came. So in chapter 5 of my book, I write about the kill phase and the build phase. So there are many different approaches you can take to wiping out Candida, but I gave a presentation in August 2014 in Sydney at the Australasian Integrated Medical Association conference. And there was about 300 doctors there, and it was well received. A lot of doctors came up to me after and said that it was a fantastic presentation and that they were going to use this 2-stage protocol with their patients. So, and when you think about it, it makes a lot of sense to work on Candida vaginally when it's at its most proliferative stage, which is premenstrually. Okay, taking a fluconazole drug is not really going to give you anywhere the same result, or diflucan, as what I'm going to tell you now. If you follow my protocol carefully, you're going to get a 95 to 90%, 99% success rate. This is my bread and butter. This is where I get a lot of my consultations from around the world for this particular complaint. So if you pay a lot of attention and care to what I'm saying in this video, or watch it a few times, and you understand the most important points, you will cure this yeast infection. You will get rid of it once and for all. You won't have to go back to your doctor time and again. You won't have to have all these relationship problems or chronic itch or crying or pain or discomfort anymore. Okay, that can all be resolved if you pay attention. So you need to get yourself some good quality garlic, some fresh garlic. You can also use a Kyolic aged garlic extract, but I think fresh is best. I prefer patients not to use Chinese garlic, imported Chinese garlic that's been irradited, but fresh, locally grown garlic. If you live in America, you'll get fresh garlic. If you live in Canada, if you live in Italy, wherever you live, there's usually good quality fresh garlic you can get. So preferably that year's or that season. So cut a clove, taste it on your tongue. It should have quite a good bite or sting to it. So get a small clove and just crush it with a blade and gently chop it up. Peel it, chop it up really fine, and then get that in a bowl and put about a teaspoon, 1 to 2 teaspoons of a good quality apple cider vinegar in with that chopped garlic. Okay, mix that together and then get a big heaped tablespoon of yogurt. Now make sure that the garlic is finely minced. Mix the yogurt, cider vinegar, and the garlic together in a bowl. Okay, now you're going to apply that vaginally. If you get an applicator like a turkey baster, or if you mince it fine enough, really fine, you can actually apply it with a vaginal applicator, which you can get from your chemist or pharmacy. You've got to put it high up inside. Now you're going to do this for 3 days in a row, 4 days in a row premenstrually, particularly when you feel the itch is at its worst or the discharge is at its worst. You apply this. Use a panty liner or a maxi pad. Apply this before bed at night. Go to bed and then give it a good wash out in the morning with 300 to 400 mils of water that's been boiled and cooled down. And you can add something to the water if you want, a bit more cider vinegar, and wash it out. And then repeat that the next morning and then the next morning for 3 or 4 mornings. So that's the kill phase. Now the kill phase must be used at the same time as you make the diet change. Now you can read a lot more about my diet and all I'm telling you now in Candida Crusher. You can buy the book at candidacrusher.com. If you don't want to buy it, you can read some more information at yeastinfection.org naturally. So that's the kill phase. The build phase, you wait till the period's finished, and what we're doing now is we're going to do a similar thing for several days in a row, but we're going to use a yogurt and a powder. So we're going to use a good probiotic powder, preferably one with good levels of Lactobacillus acidophilus in it. You can either roll a tampon in the yogurt with the powder and insert that, or again you can use the applicator and a pad and put it high up in the vaginal area, and then sleep like that overnight, and then do that for 3 or 4 nights in a row, and then wash it out again in the morning. So that's the build phase. Now the kill and build can be done for anywhere from 2 nights each up to 4 or 5 nights, whatever you feel comfortable with. If you don't get a resolution of this protocol, okay, within a couple of menstrual cycles, don't feel significant improvement, I take it you would have this stage already anyway been to your doctor and been checked out. Make sure that you haven't got anything, any chlamydia or any other, or an STD or something else going on. If it's a particularly smelly or offensive discharge, you could have bacterial vaginosis, which is probably more common than a yeast infection. So make sure, if in doubt, that you always go to your doctor and get checked out, so the doctor gives you a proper diagnosis. Then it's up to you to decide which treatment you want after your diagnosis. This is what I should have told you at the beginning of the video about the diagnosis, but it's up to you. So get checked out, find out what it is, treat adequately. If you really want to cure this thing and it's seriously bad and you're not getting much result with the garlic, you can use boric acid. Now boric acid sounds quite vicious because of the word acid, but it's not vicious at all. It's been used for over 50 years for this particular condition. It's actually written up in different gynae journals going right back to the 1960s. I've seen some citations on boric acid that are used for vaginal thrush. 99% plus effective. Okay, you get some 00 caps, so you can buy some empty capsules from the chemist. You can buy boric acid from the chemist or from your hardware store. It's used to kill ants. All right, doesn't sound the best, but I'll tell you it works. So put the boric acid in the capsules, and you're going to insert 4 or 5 capsules again, and you're going to do that for 3, 4, 5 nights in a row, premenstrually, guaranteed to wipe thrush out. Super effective treatment. When I gave my presentation in Sydney, a lady in her late 60s came up to me. She was a gynecologist, and she said, "Eric, I've been recommending boric acid for 30 years. She said, it wipes thrush out 100%. She said, I know exactly where you're coming from. She said, I used to make it up myself, and a lady at the counter used to dispense it for patients. So she said, I totally endorse this therapy. She said it should be used by all medical practitioners. Now, boric acid is far more effective than fluconazole. Using it locally, it's going to kill the yeast infection. Now, why didn't I recommend it up front? Because many women get a significant relief and cure just by using garlic and yogurt and the apple cider vinegar. Okay, now don't use a cheap cider vinegar. Use a good one, a high quality one, an organic one, preferably from your organic health food shop. So there you have the treatment. You've got the 2-stage treatment. You can either use the garlic, the cider vinegar, and the yogurt as the kill, or you can use the boric acid. There are many different other things you can use. You can also use a water-soluble tea tree oil. You can use a colloidal silver. You can even use grapefruit seed extract. So chapter 5 of my book explains everything. There's 42 pages of information in that chapter 5. It's worth the cost of the book alone. That information is superb. Be sure also to please do my survey. Go to candidacrusher.com and do the yeast infection survey to see if you've got mild, moderate or severe yeast infection. That will give you a good idea as well. And don't forget my antifungal product, CanXida, which I developed up specifically for patients like you with vaginal thrush. It's the best antifungal on the market. If you're looking for a herbal, natural cure, this is the one to take. It works perfect with the vaginal treatment, particularly if you do the diet at the same time. So I hope that gives you some good insight today on how to cure this condition. Don't fall for the baloney that you can cure vaginal yeast infection in 1 hour or even 12 hours. It's a load of crap. You can't do that, okay? It takes weeks and weeks and several menstrual cycles to cure this condition. You can get symptomatic relief, but there's no cure possible in 12 hours. It's crap, all right? After treating thousands of patients, I've never seen a 12-hour cure yet. So don't fall for this line. So I hope this has given you some good information. Thanks for tuning in today.